Thank you, Mr. President. Mr. President, I am here this afternoon on the floor to join with colleagues as we discuss the Comprehensive Addiction and Recovery Act, CARA. I would suggest that from the perspective of families across the country, so many would look at this and say this is probably one of the more important pieces of legislation that this Senate could be taking up this year. As we think about this crisis, this epidemic that we're seeing across the country with opioid addiction, it's probably one of the most pressing public health issues that are facing American families all across the country. And as we've heard from colleagues, this is not just one single state's issue. This is not just one region of the country. This is across all 50 states. I always like to think that Alaska, because we are so far away, we are so remote, that perhaps we might be insulated from some of the negative aspects of just this modern society. And in fact, we cannot isolate, we cannot insulate ourselves from the scourge of the drugs and the drug addiction that we are seeing. And this addiction does not discriminate. It doesn't discriminate against any demographic, any group. It can't be, again, confined to just a single geographic region. It impacts young people. It impacts our older people, the lower income people, the middle income people, higher income levels, those who have served our nation as our honored veterans, pregnant women, even newborn babies can suffer from addiction. And the stories that we hear when we are back home, visiting with our constituents, talking with friends, talking with neighbors, and then hearing these stories recounted on the floor. These are heartbreaking stories that come from all over the country, from the East Coast, again, all the way to the most remote villages of Alaska. We have seen and we have heard the pain of opioid addiction causes, and it's so important then that we be taking action. We address this issue now before it worsens. And unfortunately, as we see the statistics, that's where it's going. That's the trend. That's the direction. The rates of addiction and hospitalization will only continue to skyrocket unless we can throttle this back, unless we can get our hands around it. This is our opportunity to not only treat, but to prevent opioid addiction. Lots of numbers have been discussed on the floor about this epidemic that we're seeing, and the numbers really are horrifying. In Alaska, the mortality rates related to opioid and heroin abuse have more than tripled since 2008. In 2015, we had 33 Alaskans die from heroin overdose, perhaps even more than that, that we just haven't been able to identify. The rates on inpatient hospitalization for heroin and opioid poisoning have nearly doubled since 2008. The cost is over millions of dollars. And as we know, it is often our young people that suffer the addiction the most, and certainly the most directly. Between 2009 and 2013, the rate of individuals between 21 and 29 years old being admitted to treatment centers has doubled. And again, we're talking about numbers, we're talking about statistics, but we're really not. We're talking about our friends. We're talking about family. We're talking about neighbors. But we can make a difference if we provide the resources and if we provide the education and the outreach, not just to young people, but to all, so that they understand the dangers of opioid addiction. And unfortunately, some of what we have seen with this addiction is that somehow or other opioids are viewed as less a health threat because they are prescription. And what CARA does, what this legislation in front of us does, is to help address the educational need, provide states and communities with grant options and resources to ensure that all in the community, the educators, the parents, the doctors, other members of the community have the knowledge and have the tools that they need to guide and support young people and the community at large. But it is just so hard. It has been so hard to see families and friends lose their loved ones to this addiction. In the community of Juneau, our capital state, over the past several months, there have been a series of newspaper articles that have chronicled how that community has been impacted by the loss of young people due to heroin. 6 young people, all under the age of 30, were lost last year. In September, we had a young man who was a softball player, lost his life due to heroin overdose. 2 weeks after that, another family lost a son who was going to film school. You read the stories, you read the details about the lives of these young people, and could be like any of us until something happens. And what that something is an exposure to opioids and an addiction that, again, cuts a life short. And those parents of these young people, as parents in states all across the nation, grieve for the loss of their children and wonder what could they have done to perhaps help save their child's life. And again, that's the community of Juneau that is recounting that, but it is all over our communities. This drug addiction knows no boundaries. It's seeped into, it corrodes Alaska's most remote and rural communities. And these are communities, I will remind you, that it's not like there's easy access to them. These are communities, 80% of the communities in the state of Alaska are not connected by road. In order to get to them, particularly this time of year, the only way to get in is to fly in. It's expensive to fly in. In the summer, there's water options. But again, that too is expensive. And so somehow or other, while it's difficult for people to move in and out, somehow or other the drugs are coming in and out. The heroin, the opioid addiction has found its way into these remote communities, leaving families and loved ones just scrambling and desperate as they try to help those that they love. And unfortunately, the resources that we have in terms of any form of treatment centers are so incredibly limited. One of the communities that is on the road system, community of Palmer, just north of Anchorage, our largest city. I was at an event this summer, lots of people and everyone wanting to talk to me at this picnic. And there was a woman with her daughter who was in her early 20s. And that woman waited patiently to be able to speak with me alone. She asked to go off into a corner of the outdoor area that we were in so that she could speak to me about her daughter's situation. Her daughter was an addict. She had been in and out of jail. She had been in and out of treatment. Nothing had worked. And this mother had no place else to go, no place else for her daughter to go. And so she, as one mom who cared, was trying to help raise the awareness of the lack of facilities, the lack of treatment, and the lack of options for so many in her situation. And you listen to stories like that, and you realize we must attempt to do all that we can. And granted, we're sitting here in Washington, D.C. The federal government doesn't always know what's best. We know that for a fact. But how is it that we can help these families, these communities, as they deal with, again, this scourge that has afflicted so many? We had some good news in the state of Alaska. Just this week, the Alaska State House of Representatives passed a bill that will remove civil liabilities for providing or administering the drug naloxone to treat opioid and heroin overdose. It was actually the representative from Juneau, Representative Munoz, who spoke to the need for reform and helped lead this important measure. So that is on its way to the governor's desk. Again, I think an important option for life-saving treatment. So as we work together, those of us that have co-sponsored the CARA bill and all that have expressed their concern, we know that we need to keep the pressure on, we need to keep the momentum up, not only in Alaska to address this, but around the country to fight back, to deal with this addiction that we're seeing, and to really attack the issue from every degree, from mental health to criminal justice reform, community programs, educational resources, tools for veterans and for pregnant women. Addressing this widespread issue with a widespread response is important. So I thank my colleagues who have led on this issue, and the presiding officer here today has clearly done just that. I thank you for your leadership on this. And as I have spoken this afternoon on opioid addiction and more perhaps specifically to heroin addiction, I also feel compelled to mention that in my state, and particularly in Anchorage, we've seen a spike of spice abuse. This is the synthetic marijuana. More and more, we're seeing individuals that are being sent to the hospital. It's our firefighters that seemingly are responding to more spice and more heroin incidents than they are in responding to fire calls. So recognizing that it's not just heroin, but it is other drugs that are truly wreaking the havoc on our families and our communities, that we need to unite together to make a difference. So I think what we're doing here in this body is a first step, that passing this legislation is an important response, and through what we're doing, we can work to change the direction that unfortunately we have been on that path. So with that, Mr. President, I yield the floor and would suggest the absence of a quorum.